Hi there, good morning, good afternoon, and good evening to you all. Thank you so much for joining us for the second webinar in the Economic Inclusion Learning Series, organized by the Partnership for Economic Inclusion and socialprotection.org. These sessions are aimed to facilitate peer-to-peer learning from diverse experiences as countries move towards economic inclusion programs to scale. So, first, maybe a word about our organizers, who we want to thank for working so hard in the background. Maybe we can go to the next slide. So the Partnership for Economic Inclusion, PEI, is a global multi-stakeholder partnership supporting the adoption of national economic inclusion programs that increases the earnings and assets of extreme poor and vulnerable households. It brings together global stakeholders to catalyze country-level innovation and consolidate and share global knowledge. It has a strong emphasis of learning by doing, and this session really reflects that, that philosophy. And socialprotection.org, as you know, is an online member-based knowledge sharing and capacity building platform open to many different stakeholders. So on to today's session. I'm so excited that we'll be getting to hear firsthand from three experts working in this area. It's on the Bihar Rural Livelihood Promotion Society, known commonly as Jeevika, in the state of Bihar, India, and also its recent initiative to build the SJY graduation program into its infrastructure. This will integrate 100,000 of the poorest and most vulnerable households within its self-help group structure. I'm particularly excited, not just because of its size, but also its ambition. Jeevika is one of the world's largest programs for strengthening rural financial inclusion and livelihoods, and operates as part of the Indian National Rural Livelihoods Mission. And the SJY program is also one of the largest known government scale-ups of graduation programming within a large economic inclusion effort. So before we dive into this exciting session, let me start with a few intros of who's on the panel with us today. So I'm Doris King, Program Manager at Co-Impact. For those of you who are not so familiar with us, Co-Impact is a philanthropic collaborative that brings together philanthropists, foundations, and other funders to jointly support systems change efforts in the areas of health, education, and economic opportunities, primarily focused in the Global South. We have the pleasure of supporting both PEI and also Jeevika, Bandhan, and JPAL in their SJY program scale-up, which we'll be covering today. And for the purposes of these sessions, I'm going to be your moderator and the timekeeper. And I'm excited that we have with us the three experts from Jeevika and key technical partners. First, we'll be hearing from Paramveer Singh. Paramveer is a resident consultant at the World Bank for Jeevika 2. He provides technical assistance and support for the implementing agency and program delivery. I know that he brings with him rich experience across a wide range of sectors. He's also previously worked at the UNDP, and I know he has working experience from Jeevika. He'll be taking us through the journey of Jeevika, really, as how it grew and also how it is now incorporating the SJY program. Next, we will be hearing from Shagun Sabarwal, Director of Policy Training and Communications with JPAL South Asia. She leads the advancement of JPAL South Asia's partnerships with government, donors, civil society organizations, and JPAL affiliates to establish new research and disseminate policy lessons and scale up successful social programs. I know she'll be covering in her session from a research perspective, the importance of impact, evidence, and data in driving policy change, and also specifically speaking to reflections on the SJY program scale up. And finally, we have with us as discussant Mr. Arijit Dutta, who brings with him 3 decades of experience in the social sector. He is the Executive Director of Bandhan, Konnagar. And the organization itself covers a holistic transformation working with the underprivileged community across health, education, livelihood skills, development, and financial education issues. They run graduation programs themselves, and recently they have also started working with not just Jeevika, but also other government agencies in the scale up and the inclusion of economic inclusion programming. So I'm excited to hear from you all. Just a point of housekeeping. I will be apologizing to the speakers in advance. I will give you a warning when we're getting towards time for the end of each of your sessions, so that we leave enough room for the live Q&A session at the end. And to our audience, although you can't speak to us directly, there is a chat box where you can type in your questions that will be answered in the Q&A session. And we would encourage you to type in the chat bar throughout the session. With that, I turn over to Paramveer. Thank you, and please take us away.
Thank you. Thank you very much, Doris, for this introduction. And before we move on to the presentation, let me just say that while I am a consultant with the World Bank, I do straddle the line between being a technical assistance provider to Jeevika and actually being a long-term associate of the program. I started my career with the Jeevika program back in 2012 as a young professional. And the presentation that I give here today is not so much on behalf of the World Bank, but more so on behalf of the grassroots implementers of Jeevika, who are actually doing a wonderful work right now as part of the COVID-19 pandemic as well. Let's jump right in into the presentation. Next slide, please. Yeah. So if you look at the context of Bihar, I mean, if Bihar was a country, it would have a population pretty much the same as Philippines, but with less than half of Philippines area. And in terms of economy, the per capita GDP would be closer to Mali or Rwanda. The Human Development Index of the state is actually at the bottom of all states in India. And the bank branch density per 100,000 people in case of Bihar is less than half of the national average. Agriculture, which basically contributes to more than 50% households' incomes in case of Bihar, is highly affected by acute fragmentation of land. If you can see, 91% of the land holdings in the state are below 1 acre, which means there's no economies of scale to work with for these small farmers. Next slide, please. If I had to distill Jeevika's objective in the most simple terms, I would say that there are broadly two objectives that Jeevika has. First is, of course, building the demand side capacity for effective engagement. This effective engagement would be with both the public sector and the private sector, and would in turn also make these sectors accountable to the population that they serve. And the second would be to build a massive social infrastructure, a kind of a delivery channel which can support plug and play for different programs, different initiatives of both governments and private sector. And there are certain significant advantages of working with the platform, which are in terms of targeting the poorest sections, delivering customized solutions of very complex issues, and sort of creating scalable programs out of them, and supporting other similar programs with which the Jeevika program might have synergies. Next slide, please. So what is at the core of Jeevika? It's this three-tier institutional structure that you right now have on your screens. And the institutions at all three levels actually interact and complement each other in terms of outcome delivery. At the bottom, you have self-help groups consisting of 10 to 15 women. These are basically neighborhood groups. And if you look at the scale of the program, nearly 11 million women have been mobilized into more than 926,000 such self-help groups. The primary objective or the primary function of the self-help groups at the basic level is to provide capacity building support collectively to these women groups, and to support in accessing financial services of both savings and credit. Then you move on to federations, which are actually village level institutions having anywhere between 120 to 200 women. And these institutions actually work on one scale up and actually look at issues which are slightly broader, which include food and health security and convergence with both government programs as well as Panchayati Raj institutions. You move on one level further up and you have a much bigger institution, which is cluster level federations. these will have anywhere between 4,000 to 7,000 women. There are more than 1,000 of these, and Jeevika plans to have about 1,600 of these by the end of the program. And these cluster level federations actually support economic clusters around specific activities, depending on what is the production advantage of a certain geography is. Could we move to next, please? In terms of the interventions that Jeevika supports, they can be broadly classified into two major streams. One would be income enhancement, where you're actually looking at focusing on financial inclusion, diversifying incomes through support in multiple sectors, and linking these small producers and farmers to markets. As part of financial inclusion, let me first clarify that the program actually supports capitalization of institutions at all three levels. So both the self-help groups as well as federations at the village level and cluster level are capitalized through program support. The capital is primarily given as revolving funds, and there are no individual grants at the community level. Apart from income enhancement stream, the other side of the program is around vulnerability reduction, which is actually a big focus more recently in wake of the COVID pandemic. And if you look at the three key segments in that, one is, of course, access to entitlement. So you have fair price shops being run by VOs, convergence with large-scale employment guarantee programs of the government, social security pensions, also food credit lines at village federation level. And more recently, the program has also added another intervention basket to it, which is around health and nutrition security. This includes specialized credit line at federation level to support health-related loans and convergence with local health institutions. And most importantly, large-scale behavior change communication to support an improvement in dietary intake in rural areas simply by creating awareness about what food groups maternal and child beneficiaries should be eating. Could we move to next, please? If you look at the investment timeline of Jeevika, the project started way back in 2006 as Bihar Rural Livelihoods project with an outlay of about $67 million. Post that, it went on to additional financing in 2011 because it was extremely successful with another 100 million. In 2012, NRLM, the National Rural Livelihood Mission, was actually launched nationwide. And it actually looked at many of the lessons that Bihar and some similar other programs in southern India provided. In 2014, Jeevika did a scale up, and in 2018, we had the third round of investment from the World Bank of 290 million. As Doris just mentioned, in 2018, the program also launched a separate stream called SJY, or Integrated Livelihoods Program, which focused especially on ultra poor program. If you look at the three phases of Jeevika, there was a big learning phase initially, which focused on building community resources and sort of developing pilots and fine-tuning interventions. Then there was a big scale-up phase from 2012 to 18, where in about 6 years, Jeevika actually massively expanded across the state. And now we are in the deepening phase, which focuses more on higher generation economic outcomes. The World Bank has invested close to about 500 million in this platform, especially through the state level projects. This does not even include the financial support which the program has received from national level programs of the bank. Could we move to next, please? So where were we in 2007 to 2009? We were a very small program in just 59 villages, just about 70,000 families, only about 20 crores, which is about $3 million in bank credit, and about 5,000 farmers were reached through an initial pilot with a local NGO called Pradhan. Moving on in about 1 decade where we are, we can see that in the next slide. There it is. So Jeevika today is an ecosystem of 10 million plus households. We are spread across 44,000 villages across all blocks of Bihar. 2 million small farmers are supported through the program and about 1.2 million small enterprises. There are 900,000 plus institutions And most importantly, it has 120,000 community professionals, which is the biggest workforce working on ground actually to provide technical services. There is 6,000 plus professional staffs and about 30 plus development partners. Some of them are here today joining us in this session. Right now, Jeevika is actually leveraging close to 500 million US dollars in bank credit from formal financial institutions every year to support economic activities on ground. Next, please. This is the implementation architecture of Jeevika. If you look at the bottom and the most important and critical piece of Jeevika, which is the cadre of community resource persons, bookkeepers, and community mobilizers, the only way a program of this scale can actually be implemented effectively is if you build local resources who can provide technical support. This is not only important in terms of creating more sustainable structures, but also cost effectiveness of a program in the long run. Then you have block level implementation units and further at district and state level. I must also point out at one specific unique HR innovation that Jeevika did back in 2012, which was to institute the young professional policy in Bihar. The focus was to attract high quality postgraduates from premier management institutions and social sciences institutions across the country who would come and work on the grassroots and develop new ideas and test new pilots, which can then be taken to scale. Even the STY program, which we currently have, which is focusing on ultra poor graduation, an approach which is very, very different from what Jeevika has been doing in the last 10 years, was tested very, very quickly and fine-tuned to integrate with the core program structure through the help of these young professionals. Next, please. Let's look at some of the results of the Jeevika program. I think first and the most important result that Jeevika has had is that it has created an extremely inclusive institutional structure. If you look at the participation of SCs and STs, the traditionally vulnerable communities, in case of Jeevika, more than 30% of Jeevika's women members are belonging to the SC/ST households. If you compare that with the population of Bihar, only 18% of Bihar's population belongs to the SCs and ST communities, but in case of Jeevika, it's almost 1.5 times that. So it clearly points out to how inclusive the program has been. One more important point, and this is very, very important in case of a context like Bihar, where financial services are highly constrained, the groups actually help in amplifying the reach of a bank. As opposed to reaching to each individual member, they could now reach to 1 million groups and in turn actually reach to about 12 million people. $1.7 billion have been leveraged from banks in the last 10 years. And as opposed to the credit to deposit ratio of Bihar, where for every $1 deposit, only 0.45 goes out as credit. In case of Jeevika, for every $1 deposit or investment that has gone into the program has been able to leverage $2.6 in credit so far. Next slide, please. The focus, as I said, in the initial years was more on institution building and mobilization, and now the focus is on actually leveraging this platform to deliver economies of scale for small farmers. More than 1.2 million farmers have been reached through extension support services. There are about 5,000 village resource persons which are working in rural areas. There are about 400,000 rural households who've been benefited through collectives which are working specifically on different sectors like dairy, poultry, and enterprise. And more recently, Jeevika has actually gone big time into promoting large-scale farmer-producer organizations, which can actually take the produce of small farmers, aggregate it, value add, or directly bring it to large institutional buyers, and actually give a higher share of the consumer price to these small farmers. We're expecting that by 2023, these FPOs will reach an annual turnover of $100 million. Of course, the recent pandemic has put in a spanner into our works, but we hope to cope up with that as well. Next. In case of digital finance and insurance, so this again is a very unique story in case of Bihar. In 2019, Jeevika facilitated insurance of 2.2 million women members under public insurance program. Generally, what happens in case of large public insurance programs is that while there is an entitlement which is available to these beneficiaries, due to lack of awareness and actually a channel which could deliver these services down the line, the enrollments stay very, very low. If you look at in case of Bihar, 85% of all enrollments which have happened in the states are actually belonging to Jeevika women members. More than 600 plus banking correspondent agents or digital banking touch points are being run by SHG women in rural areas, and they're actually facilitating transactions of more than $20 million every month. During these nationwide lockdowns which have happened in case of COVID, these channels have been extremely helpful in actually bringing cash to the rural poor from their bank accounts to their hands. Next, please.
Param, you have 2 minutes left.
Sure. Just as I said, there is a great focus on the enterprise side of the program, and we're actually building clusters across specific activities, whether it is related to rural retail, whether it is related to honeybee keepers, more recently professional catering services to hospitals, and supporting viewer collectives. Next, please. So what makes Jeevika tick? I think there are 5 key factors. First is, of course, looking at the power of federation, harnessing the power of collectives across sectors and issues. We're focusing on saturating. So we're not looking at selectively mobilizing. We're actually looking at massive, large-scale mobilization that minimizes exclusion errors as opposed to inclusion, localization, as I talked about earlier, and professionalization. And more recently, and actually this again is something which has happened in Jeevika over the last few years, is that we've had a slew of technical partners to support us in various programs through which we've built our own internal capacities for scale up later on. Next, please. So what is the SJY program? This is again unique to government of Bihar, and I think one of the first instances of a state government in India undertaking graduation approach at this stage. We have a budget of 115 million, and we are focusing on bringing the poorest 100,000 households permanently out of poverty. Some of our partners will be also speaking here today, who include JPALP and Bandhan Konnagar Foundation. Next, please. So this again is an example of how Jeevika is able to actually look at complex issues and customize it to suit the institutional platform. So as opposed to using the Puritan approach, which was there already in case of BRAC and Bandhan, we have been able to customize the approach to suit the needs of the Jeevika program, where it is related to identification, where village federations were extremely involved in participatory identification of the poor, to micro-planning and asset transfer, where VO purchase committees actually took a lead, to actual integration into the SHGs. So in case of Jeevika, we are actually in a stage where we know where we want the graduation households to be, even after 2 years, and not just within these 2 years. We already have a path laid down for these ultra-poor households, even beyond these 2 years. Next, please. So where are we 18 months into the program? We started somewhere in August 2018. As of now, we have identified more than 70,000 ultra-poor households under the program, and 34,000 of them have already received first tranche of their productive assets. Close to 1,200 master resource persons are actually supporting these households on a day-to-day basis. And we already have identified 6 enterprise clusters. As I said, the young professionals and block-level resource persons from Bandhan have been extremely supportive in scaling up of this program. Next, please.
Hi, Param. Since we're at time here, I was thinking we'd do some real life iteration and cover COVID within our Q&A session as the first thing. Thank you so much.
Sounds good. Thank you.
So with that, to our SP.org team, I think we'll transition now to JPAL with Shagun. And thank you so much again, Param, for that interesting walkthrough of how Jeevika really developed. And what I find most interesting about the SJY experience within Jeevika is that it's primarily a livelihoods intervention that's going to be delivered through a financial inclusion infrastructure, which differs from the better known cash plus approach of government agencies that leverage social safety net infrastructures. And all of this and more will be covered in the upcoming PI State of the Economic Inclusion Sector report that will be coming out in the summer. Another thing that it'll be covering is the importance of evidence and the role that it plays in understanding what really works and how to drive policy. So with that, I think that's a segue over to Shagun and Jaypal to hear from your experience of working with Jeevika and Bandhan in the SJY program and more. Thank you.
Thank you, Doris, and thank you so much, Param, for the presentation. So, Doris, can you hear me? Okay, I assume that I am audible. Okay, great. So, yeah, great. So first of all, I would like to say a big thank you to the organizers, to PEI, and to the co-panelists for sort of organizing this particular session. I'm really excited to talk about the work that Jaypal South Asia has been doing in partnership with Jeevika and Bandhan Konnagar. And I think this is a topic very close to my heart. So I hope that you all find this useful as well. So what I'm going to do in this session today is that I think Param has really talked a lot and set up my presentation really well to take us through the work that the government of Bihar and Jeevika specifically has been doing to lay the foundation of what you can imagine as being an engine or a platform on which then the government can really roll out many more social protection schemes and reach a lot of the people who probably were not before under the net of the social protection net that the government of Bihar had. So now what I would like to do in this particular presentation today is to talk about the graduation approach, or the targeting the ultra poor approach that it was known as previously, and see how can we sort of think about scaling this up to the scale at which it is now going with Jeevika. So the whole presentation has to be seen from the lens of what are the learnings and the lessons when one takes a program that has been proven to be very effective across different contexts, but has been implemented at a smaller scale with NGOs. When you take it to a government implementing that, what are some of the lessons that we can learn from here, and what are some of the exciting developments that happen as this goes on? Next slide, please. Next slide. Yeah, so what I would like to first do is just to take a step back. Many of you in the audience here may already know about the graduation approach, but I still wanted to just bring everyone up to speed on this particular approach and what it is really all about. So essentially, thinking about poverty as just a dichotomous category of poor and non-poor may not be the right way of looking at this. And we know by now from a lot of work that's happened across many different disciplines that poverty is very multidimensional. Another way of looking at this is to say that within those who we can consider as poor according to different definitions, there is also relatively those who are really the poorest of the poor, or who are really at the lowest margins of this continuum. And these are people who have many more vulnerabilities as compared to those who may be wealthier as compared to these people. And one of the major problems with in accessing these people is that they are almost invisible. They may not have, the government may not have been able to connect with them. They are usually sort of excluded. They're typically in the margins. They don't have identity cards. They're not able to access the social protection services that the government may be offering. So the graduation approach really targets and identifies these people. And the entire focus then becomes how to make them, sort of improve their conditions in a way that they can then connect back to the formal mechanisms and systems that exist in any particular society. So in a way, you have to look at the graduation approach as being a complementary policy innovation that can complement the other social protection efforts that the government may already have put in place. So it's not to be seen as a substitute, but rather as a way to complement other efforts that the government or other NGOs may be doing to reach the poor. Next slide, please. So this again, I mean, just taking a step back in providing some context to this. A lot of us here know, of course, that India has, taken tremendous strides in economic development, and we have our per capita GDP has been continuously increasing, and there has been a lot of we have coming into the middle income category as well, but there are still segments of society and substantial segments at that who continue to remain in this ultra poor category, and extreme poverty continues to persist. And this is just some data that is from the socio-economic caste census, which was conducted in 2011 by the government of India. And here they basically sort of divided people or households according to their deprivation category. And we find that there are still quite a few people in India who belong to this deprived category. Next slide, please. So now I think what I would just like to very quickly go through are the different aspects of the graduation approach. So essentially what the graduation approach is, you can think of this as a big push intervention to push these people who are kind of stuck in this poverty trap. And what it means by poverty trap is that they continuously suffer from not having consistent regular income. Any kind of economic shock puts them back significantly. They're not able to even have enough food security, and on many different dimensions, socially, emotionally, and physically and economically, these people continue to remain sort of very highly vulnerable. So what the graduation approach does is that it identifies these people and then puts them on a trajectory, puts them away from a trajectory of ultra poverty and poverty trap to a trajectory of self-employment, where they can go on the path towards sustainable livelihoods, and then also link up to the formal social protection schemes and mechanisms that may be available through the government. And what this does is it's a time-bound program, but it has many different components. A major one, of course, is the transfer of an asset and income allowance or consumption allowance for those 24 months, but that's about half the cost. The rest of it is really to provide a lot of hand-holding support to these beneficiaries so that they can really kind of almost be pushed out of this poverty trap. Next slide, please. So what I wanted to just like take a pause here and say that this particular approach was pioneered by BRAC in Bangladesh, but since then it has been replicated across multiple contexts. So one of the questions was that, well, it seemed to really work in Bangladesh, but can it work in other countries? And there were a series of randomized evaluations that happened across 6 different countries. They were implemented by different organizations, and one of the countries, of course, was India as well. And Bandhan Konnagar was our implementing partner where in West Bengal, where the study was implemented. And Arijit and Esther Duflo were some of the researchers who did an evaluation of this particular study in West Bengal. And then there was a paper in Science that got published where the results from across these different countries were pooled. And what we found was that across a range of different outcomes, starting from income, revenue, consumption, mental health outcomes, food security, we found positive impacts across all countries. And even in a country like Honduras, where the impacts were not as high as in other countries, we did find the ultra poor people benefiting, say, when it came to the food security outcome. Then the second question that, of course, comes to mind is that, okay, what are the long-term impacts of this particular program? And here again, we find from data both in Bangladesh and in India that the effects continue to be there even in the longer term. So 7 years down the line as well, we find that in India, the households who had got this program 7 years ago continue to remain on the track of being better off than those who did not get it. Their savings were up by almost more than 200%, and they continue to have their assets, and they had diversified their asset even 7 years down the line. Next slide, please. The third question then, of course, is that what is the cost effectiveness of this particular program? So yes, this program does cost. It's about rupees 30,000 per beneficiary. But again, like I said, half of this cost is about the asset and the consumption allowance that is given. But what is really important to know is that if you really compare the costs with the social benefits that you get, and here when we did the cost benefit analysis, the outcome we took was only consumption. So we are not even taking into account the other benefits that accrue to the families. But even then, we find this program to be highly cost effective. And again, because it has long-term impacts, the cost effectiveness increases even more. So now, next slide, please. So now we have a program which seems to work in multiple contexts, which seems to be cost effective and has long-term sustainability. But this is where our story pretty much begins. And the story is now, do we think that this program can be incorporated as a part of government social protection systems and be made a part of the routine social protection schemes that the governments offer? And how can governments actually scale up a program like this, having multiple components and being fairly complex in countries? So this is where we are at today. And these are some of the questions that we are trying to answer through the work we are doing in Bihar. So the first thing I wanted to mention here was that JPAL South Asia has been working with different state governments and with Bandhan Konnagar. Bandhan Konnagar has been our partner in across any collaborations that we have had so far in India. And different state governments have come in and been very excited about bringing this program to their states. And we did a mapping to see which states were the ones where there were substantial populations of ultra poor. And of course, among all of these states, the one state that stands out is Bihar, where our work, or where, like Param already said, the graduation approach is being scaled up in the form of the SJY program, and Jeevika has adapted this particular program, which is extremely important because you cannot just copy paste a program and just expect it to scale up. So there have been multiple adaptations that have happened of this particular program in Bihar context, and we are right now on that journey. Next slide, please.
Shogun, I'm sorry, we're running towards the end of the time of your session. So maybe if I can just ask you about that, because it's such an exciting topic on, really evidence plays such an important role in the work. And what role, like especially as you look at the SJY program, what role do you see data and evidence playing as we move to scale up? What type of research, design and tools are important, especially when thinking about embedding programs within existing government systems?
Yes, absolutely, Doris. So I think what I would say is that this is something which is extremely important, and Jeevika has been extremely open to having a very strong learning and knowledge generation component as it scales up. So there are two ways to look at this. The first is that the governments, typically in India and I'm sure in other countries, also have their own MIS systems where they're collecting live data, and Jeevika has invested in this MIS system for the scale up of SJY. But in addition, they are very keen, and what we are doing currently in the form of a process evaluation is that we are collecting data directly from the field, which is then informing through an ongoing feedback loop the operational decisions that the government
I think we lost the audio. I'm sorry, just give us a moment to work this out.
Yes, sorry, I got muted by the organizer by mistake. I think my time is up. Okay, so very quickly, I think all I want to say is that these insights directly from the field on even very small things like how do we build the capacity of the cadre of people who are implementing the program, and it's not just about classroom, but it's also about doing hand holding, or a lot of such insights that we are coming up with are being found to be extremely useful for Jeevika. So I would say that data on an ongoing basis is extremely critical for ensuring quality at scale.
Thank you so much for that. And I think, with our segue next to hearing from Bandhan, we can also hear more about the partnership that you are doing work together on with other states as well. So thank you so much for that, Shogun. And we're also parking the COVID discussion until the end in our Q&A session. So next we'll be hearing from Mr. Arijit Dutta, from Bandhan, and as said, they take a whole of household approach to how they address underprivilege and vulnerability and poverty. And specifically, they run graduation programs. Their experience in direct implementation has led them to this work in providing technical assistance in the SJY program, working alongside with JPAL, who we've just heard from. And again, pointing to the upcoming PEI State of the Economic Inclusion Sector Report. It really does highlight the critical role that NGOs have to play as a catalyst as we move towards more and more government-led economic inclusion programming, both as an implementer and also as a technical assistance provider. So with that, over to you, Mr. Dutta.
Thank you, Doris. So, as Doris has mentioned, so let me give you some idea about this organization, and so that you will be able to understand. So, Bandhan realized that it's often the her. I'm emphasizing the her and not the him, who we have observed that they are excluded from the developmental chain by default. And we understand that her inclusion and empowerment would lead to wealth and value creation, even in some of the most impoverished areas. So Bandhan is focusing only with the women. So poverty alleviation and women empowerment is our motto, is our focus. And we are working only with the women. So as Doris has also in the initial introduction mentioned about that, we are not only working for the livelihood, but also we are trying to provide gamut of services to the targeted households related to health, education, livelihood, skill development, and financial educations. So to give you some idea, since its inception in 2001, our cumulative reach is 2.5 million households spreading over 12 Indian states. Now coming directly to the program that in Bandhan we call it Targeting the Hardcore Poor program, which we are talking about the graduation program. So you have seen Shagun has also mentioned that the destitute and the extreme poor, formal financial institution as well as microfinance institutions, they are not catering or they are not helping. There are some reasons for that also. Forget about the microfinance institutions. We have observed that many poor women, such poor women, they could not participate in India's self-help group program, which is a big success. And as Param has also mentioned that Jeevika program is totally focusing through self-help.
Hi there, I think we might be experiencing a little tech issue here, so bear with us whilst that's figured out. Hi there. So I think we had a little connectivity issue with Mr. Dutta, and we're just trying to see if stopping his video might help with the bandwidth. Thank you for bearing with us.
So Doris, if I can speak, it is okay?
Absolutely. Thank you.
Okay. So as of now, as I have mentioned that we started the program with 300 women women participants, which has now increased to 100,000 plus across 12 different states. And here I have to mention that entrepreneurial activities that includes the farm as well as non-farm activities like animal husbandry, poultry, handicrafts, vegetable, flower, fish vending, tea stall from grocery shop to rice husking, spice businesses, food product, and so on. So this is in short about the targeting the hardcore program or the graduation program, and the detailed information how we proceed that has already been shared by Shagun. I'm not going into detail of that. Now the question of scaling up of this program, and we in Bandhan always believe that scaling up of the program can be done in with the involvement of three different partnerships. One is of course the multilateral or international donors, which Bandhan has already accessed the support or received the support from CGAF, the Ford Foundation, MSDF, and DFID. Next, our approach was with the Indian corporates, because as you know that Indian corporates, as part of their corporate social responsibilities, they are also into the livelihood initiatives. So to mention a few about the Indian corporates, we have collaborated for scaling up with ITC, Indigo, Bajaj, Axis Bank, and of course the Bandhan Bank. Government, that we always believe that government is the largest donor for any developmental program. So we are working with the three governments as of now: Rajasthan, Bihar, and Jharkhand. And in case of Rajasthan and Jharkhand, we are directly implementing. But in case of Bihar, as Shagun and Param has mentioned, that we are the technical support agency for this program. Yeah. So our experience for this technical support agency, as I have mentioned, that Bandhan Konnagar is the hardcore implementing organization, and we are implementing directly our program. And this is the first time we are having our technical support services with Jeevika government of Bihar. So we understand that scaling a program with government, it will take little bit of more time, because it entails changing models, approaches, culture, as well as mindset. The models and approaches, which Param has already showed, that typically Bandhan Konnagar model that we have revisited, we have revised, involving this Jeevika as well as our JPAL. Then it is also important to have sponsorship. That is much more important. The sponsorship both at the political as well as bureaucratic level for the program of any government program to succeed. And I am really honored. Bandhan Konnagar is really proud to say that the government of Bihar at the political level as well as the bureaucratic level, the CEO of Jeevika, they have taken much more proactive role to make this program a great success. And other things also we have experienced while working with the government, it's necessary to help them leverage their own capabilities. That's why, based on their capabilities and the structure, we have remodeled, redesigned the support system. Last but not least, I would like to mention that change in the mindset. Change in the mindset, it is both required both for the government as well as the technical support agencies. So from technical support agencies, as I have mentioned, that we were used to implement the program directly. So now we have realized that TS services is moving away from direct implementation to thinking big picture and building platforms, which is a big change for us. And because we are used to solving problems in depth with large teams which are directly reportable or accountable to us and working on the ground. But we have realized that pivoting to become a TS support organization, we now understood that how we can get different players on board and capacitating them to make Jeevika SGI program better, instead of thinking about how Bandhan can do it ourselves. So that's the great learning for us. And since last 1.5 years, I would say we could able to proceed towards that, and we have got lots of support from the government as well as the Jeevika SGI team. Thank you so much.
Thank you for that, Mr. Dutta. And you know, the openness to learning and adapting between all the parties is something that's really, really inspiring to see. So with that, apologies again for the technical issues that we had, but I'm so glad they were resolved. And as we had shifted around the agenda a bit, I would now like to welcome the speakers back, all three, to talk a little about COVID and really how you've seen this impact the work that is being done and how you might see this as influencing the work that you do in future. So maybe we can start with Param. Thank you.
Yes, thank you. Thank you very much to both Shagun and Arijit for sort of complementing the information that we were discussing earlier. I'll just take 2-3 minutes to talk about the response of the institutional platform to a crisis like COVID. And I think before we look at the slides itself, and they are fairly self-explanatory, what I would like to point out is the reason why a platform like Jeevika or an institutional platform like NRLM can be effective at the last mile in dealing with situations like these is that for issues of scale, for a pandemic of this kind, which is omnipresent, you need institutional channels which are omnipresent, at the same time who have a certain degree of capacity to innovate and be flexible on ground in their local contexts. That being said, let me just share the few slides with you. Could we move on to the next, please? So what was Jeevika able to do very, very quickly? First and foremost, using the workforce of 120,000 plus community professionals, we actually undertook massive community outreach starting in the first week of March itself. That meant that at the time when it was declared as a pandemic across the world, and India had only a handful of cases, and Bihar had no cases at all, Jeevika already published more than 1 million information pamphlets and distributed them down the line. We have not been able to collate numbers as of now, but our estimates suggest that we were able to reach to more than 3 million individual households through telephone calls using these community professionals. Jeevika was also given the responsibility to undertake statewide surveys to identify households who were supposed to get ration under PDS, but they did not have ration cards. And in a span of about 10 days, Jeevika has been able to identify close to 1.2 million such households who could be issued new ration cards to provide this sort of support. In the interim, till the time these ration cards are issued, these households were actually transferred 1,000 rupee per household simply because they were identified as part of the Jeevika statewide survey. Next, please. We leveraged the scale of the Jeevika program to ensure food security at the household level. 17,000 village federations actually undertook procurement of food grains during this 1 month period of pandemic, which actually helped nearly 1 million households get crucial food supplies during this pandemic period. Close to about 36,000 ultra poor households are actually supported with 2,000 rupees cash per household as a direct cash handover. I was looking at one of the questions which talked about the lack of efficacy of bank accounts as a potential cash transfer channel. There could be debate about that. And for the ultra poor households, definitely we did not want to face the constraint of them not having a bank account to begin with. And we made sure that direct cash handover was actually made to more than 36,000 households. Next, please. And this is the last slide. Some of the key interventions that Jeevika community institutions were able to take by themselves through their innovation First and foremost, more than 2.4 million masks were produced by Jeevika women groups across the state, which meant that local institutions, whether they were hospitals, whether they were government offices, whether they were private offices, who required this sort of availability of masks locally, were able to actually tap these groups and were able to procure these materials. We have extended loan moratoriums to SHGs and working capitals to FPOs to ensure that small farmer produce is marketed on time, as this was the period of wheat harvest. Federation level capital was actually utilized for running community kitchens and food security for incoming migrants who are coming to Bihar. Digital banking touchpoints have actually seen doubling of transaction volumes for their platform. There were 106 community custom hiring centers managed by VOs, which were used at a time when large-scale machinery and combine harvesters were stuck due to lockdowns. And Jeevika SHG members, as I said earlier, are running professional cafeterias in public hospitals. These are just some of the examples of how the institutions have been able to mobilize very, very quickly and innovate within their local context to support the pandemic relief efforts. I'm going to go back to Doris and we can continue the discussion. Thank you.
Thank you so much, Param. And that's really, really impressive to see what has been done in such a short time to deal with the emergency. And with that, maybe I'll segue over to Shagun to give us, add to this what you think the SJY program has in terms of impact and role from a social protection lens in this time. Thanks.
Yeah, absolutely, Doris. So I think, like Param said, I think for me, the beauty of I cannot be thankful enough that the SJY program was rolled out and Jeevika has made tremendous strides in being able to reach almost 70,000 such ultra poor women in households. But what it really brings to us is that imagine that this is a set of people that were already not in the formal system of the government. The government didn't have access to almost this invisible layer of extremely ultra poor people, and there are not many at a village level, but they're still there, like 5 to 7 of households at a village level may be considered ultra poor. Now, thanks to SJY, they have come under the fold of Jeevika, where Jeevika is directly able to link to them. They know who these people are. So now imagine a state of pandemic where we know the kind of huge economic suffering that people across India are facing. So in a scenario pre-SJY, despite a lot of the great and fantastic work Jeevika is doing, these people may have been the worst hit, right? Because they're already so vulnerable, and then any type of economic shock as big as this would really put them out. But thanks to SJY, Jeevika has managed to transfer 2,000 rupees into the bank accounts of these women, even though they're 34,000 right now, but that's a big number. So to me, this really allows for governments to have a bank, have a data or a record of these people so that they can access them during such times where they may need the most help. So to me, this just speaks for itself, the value of a program like SJY.
Thank you so much for sharing that perspective. And Mr. Dutta, if you're there, do you have anything more you'd like to add on from the Bandhan side? I think you're on mute.
Yeah, and all. So I would particularly share about our initiative and not about this year SJY Jeevika collaboration. So through our health program and health volunteers, we immediately started awareness generation about this COVID-19 in 5 different states, and of course providing this year face masks and other kits to the primary healthcare services. This is number 1. And then of course we could find that the beneficiaries or the participants of our graduation program who we are directly implementing. So some of them, they are also into the tailoring and having sewing machine and all these things. So we could identify 20,000 such women who could able to produce 300,000 face masks, and we could get them making marketing and all these things, help them. And we then I would say 20-25 days, they could able to generate in dollar terms 70,000 USD. This is about this year our targeting the hardcore poor women who are doing it. And other is that in the initial days, the lockdown started by government of India, we could found that there are certain households who are finding it difficult to get their food, ration, and all these things. And till date, we could able to identify 10,000 such poorer households, and from our own resources, we could able to provide them cereals, pulses, edible oils, and which is also around 75,000 worth of USD. Yeah, so these are the three things we have done. And now recently we have started opening our branch offices because of the relaxation of the lockdown. So maybe in the coming months and all these things, we'll also identify who are being badly affected due to this COVID, our targeting the hardcore poor or graduated beneficiaries. So we'll come out with their solution and support for them. Yeah.
Thank you so much for sharing that. And I think with this, we will segue into the live Q&A session. And maybe starting with one that's the COVID situation is highlighting more and more is the potential need for urban adaptations, given the populations that have been most affected by COVID. So this is perhaps to Param and Mr. Dutta. With poverty still predominantly rural in India, 25% in rural versus 14% in urban. But have there been experiments that you've been doing in urban adaptation of economic inclusion programs by Bandhan or Jeevika? And what are some of the lessons that you've found and challenges and opportunities? Thank you. Param, do you want to kick us off?
Param is going to respond.
So I agree with the fact that in the last decade or so, the line between the rural and urban economies are constantly blurring. And actually, no economy, whether it is urban or rural, actually functions in a vacuum. We already are supporting to a great extent in terms of creating rural-urban linkages, especially on the production to consumer side. So a number of our farmer producer organizations are now actually not only engaged in aggregation and sale of produce to institutional buyers, but also in direct retailing in urban centers. In case of COVID as well, we saw that for vegetable farmers as well as farm producers of different commodities, this was a really tough time to actually reach to markets. And in such situations, farmer collectives actually came to the fore and were able to directly reach out to consumers as opposed to taking the traditional market route of going to wholesale markets and then to retail. So what I would say is that in case of even urban linkages, there's already some headway which has been made through farmer collectives and to some extent through enterprises as well, because if we are looking at developing value chains which are tapping into urban consumer base, then you're not only supporting rural consumers or rural producers, but you're also creating new job opportunities in the enterprise value chain in urban areas. If you're looking at selling produce in urban areas, you're actually creating jobs in the logistics sector, you're creating jobs in the retail sector in urban areas through this program. And there also, we're now looking to create a system by which we could tap urban poverty centers or urban poverty pockets where such job creation could actually be most effective. I'm going to stop at that, and we can do follow-up later on.
Thank you. And Mr. Dutta?
Yeah, as you know that we are really implementing a program, and we are not a government organization, we are a non-government organization, and Initially, yes, we do this. You're facing some problem because of the lockdown and all these things. Because our field staff or branch staff, they are not able to move here and there and all these things. But what we have observed in the sense that, as I have mentioned earlier, uh, our health program that we are really doing the health awareness and also helping the government, primary health center and all these things. And our livelihood programs, in our case, there are two different types of livelihood programs we call. One is, of course, this graduation model that I have mentioned, that we have helped them to produce the marks as well as to sell it in the urban market and the semi-urban market. That will continue to do. And the second one is, of course, helping some of these your entrepreneurs who are not able to run their business, because as we have observed that because of the migratory population, they have come back, or the people who are involved in other livelihood activities like rickshaw pulling or auto driving and all these things, since they are also not able to do those services, so they are also into these your entrepreneur activities like what our entrepreneurs they used to do. So there is a huge competition and all these things, and because of that, some of our entrepreneurs, they are facing shortage of their sale and their income and all these things. In addition to that, we have also helped them to access government facilities, be it getting direct cash, or getting some the government food subsidies and all these things, public distribution system, rationing, all these things we are helping them to get it. And other program that Param was mentioning about this, your skill development and employability for the urban poor and all these things, that we are also implementing as part of our skill building program. So as of now, we are also in direct touch, direct contact with the employers, because our employment percentage is helping the trained youths is 80 to 83%. And of course, we are also having partnership with government of Bihar for skill building program. So as of now, immediately, because of the closure of our skill building centers, we have started providing the learning and training through e-learning facilities and all these things. And we are hopeful that this type of training that will be acceptable by the employer. So in that way, we are trying to overcome the, since last 2 to 3 months, we are trying to overcome this COVID situation in our organizations and directly trying to provide the benefit of helping our partners.
Thank you so much. And following up from that, we've had a question from the floor which links to COVID and what you might foresee as being challenges and changes that would need to be made given the restrictions, in social distance and so forth that applies. So the question is, how do you foresee the group models changing in the aftermath of COVID? Group meetings, community engagements are at the heart of NRLM operations. Is it now time to innovate on these models?
Yes, so I think we have had some lessons already in the last 1.5 months in the way we have had to adopt and innovate, in these testing times. First and foremost, as mentioned by the questioner, that group meetings are, of course, at the heart of the entire program. And actually, in the last 2 months, group meetings have been totally suspended. But that hasn't stopped the business of these groups. That's simply because of the fact that more and more the focus in recent times has been on using technology platforms to facilitate group level transactions, on digitizing these transactions on these platforms, and there has been a higher uptake of these technologies. There's of course a lot of effort still needed into developing more mass scale adoption of technology platforms to do these things. At the same time, what I would also say is that this platform will actually be extremely critical in influencing behaviors down the line on how life changes post-COVID, in the sense that if we are looking at disseminating the message of social distancing, maintaining personal hygiene, hand washing practices and everything. Again, this is a platform which is going to be used massively both by the government as well as development partners in reaching out the last mile. We are already looking at developing specialized interventions and products at the federation level to undertake demonstrations on what these practices should be going forward, how group meetings need to be conducted while maintaining social distancing protocols, how personal hygiene measures need to be enforced at the community level, and how village federations will actually play a bigger role in monitoring these behaviors, as they have done in the past in case of large-scale government programs like the Swachh Bharat Mission. Even in case of the sanitation program, the Jeevika platform was massively used to not only support members through capital availability, but also to influence behavior change down the line. And if you look at the post-COVID sort of recovery or post-COVID world, I think the most important challenge that we will face, in rural areas is to influence community behaviors on how they conduct themselves in daily lives. And I think that's where the institutional platform is actually going to play a very crucial role.
Thank you for that. And we've had a follow-up question come in from the floor regarding changes for post-COVID world. So the question number 7 is, how do you think we should plan for livelihood activities after COVID? What critical points should be taken into account while livelihood planning?
All right, so here again, I take an example to demonstrate. Let's see the agriculture season, which is approaching fast across India, which is the Kharif season, which means in the next 1 month or so, availability of seed, availability of labor, availability of mechanization services is going to become extremely critical for a large majority of farm sector across India. Now, the advantage that an institutional platform of this sort can provide is to actually have local capacity for providing, for doing collective procurement of these inputs, as opposed to each and every farmer going out to the market and procuring these inputs for themselves. This will actually help tremendously in building efficiency in terms of distribution while maintaining social distancing norms, especially in case lockdowns are further extended. As far as planning for livelihood activities in the longer run is concerned, I think a number of enterprises down the line, even in rural areas, will adapt to new consumer patterns and behaviors. I'm sure a lot of our SHG women members who are running retail stores are changing the product basket or the product portfolio that they have available in their small shops. There'll be a lot more focus on protective equipment, hygiene products down the line, and there again, the institutional platform will play a role. I'll give you an example. In case of Jeevika, there are 20 large rural retail marts which are functioning right now, which are basically working as feeder units for smaller enterprises down the line, and are ensuring that these enterprises do not have to go out to larger markets for individually procuring products, and these can be supplied to them down the line so that they are well stocked and can support the rural consumption patterns. I'm sure this is an emerging field, and there'll be a lot more that we'll learn as we go along.
Thank you for that. And I think from speaking with you all before, there's definitely appetite and feeling of this that we'll learn a lot more as it comes, and learning together, and from the diverse experience that people in the community will have in this will be so important in moving this forwards. So I know we have a few more COVID questions, but just to pivot it a bit onto a topic which is really important, and given the participants profile who normally are you all work with in the economic inclusion space, a lot of the participants are women. And what role is it that economic inclusion programming could play for women empowerment? So specifically in the context of India, some preference and the perception of girls as a burden is manifested in differences in nutrition and care in early childhood years, school attendance and access to health care and other services, restricted mobility. So what do you think it is that economic inclusion programs can do to adapt, design and or delivery to increase female outcomes? And perhaps Shagun, you can kick us off on that one. Thank you.
Yes, sure, Doris. So again, I think gender is an area that's of a lot of interest to me, and JPAL has also been doing a lot of work in this sector. So I think, like you said, India, the social norms that prevail in India do put women and girls at a disadvantage as compared to other or men. And then when you combine this with poverty and other forms of vulnerability, you can imagine the impact to be a lot more severe. So I think the ultra poor programming and other economic inclusion models that specifically look at gender and the role of women are extremely critical, because what they're doing is that they're not just ensuring that there is money in the bank account of women, but they're also trying to move women to the trajectory of self-employment, have more sustainable livelihoods, and essentially calling out and customizing the kind of program that can really help women become better and prosper more. So like Mr. Dutta also said that when Bandhan Konnagar started, it was for the she. So a lot of the focus of the graduation approach has been on women-headed households. And even as Jeevika is implementing this is a focus group, although in Jeevika they're also expanding to other categories of ultra-poor households that may be there. But I think economic inclusion can play an extremely critical role, because it's not just about opening bank accounts for women, but really enabling access and kind of truly trying to empower them. So I think this is also very important, because it may also have a transformational impact, because as more women go into the market, are kind of being self-employed, are generating income, it may lead to also changes in the social norms surrounding how women are perceived in a country like India, especially in rural India. So I would say I think this has a massive potential, and I'm very happy that we are looking into this focus area.
Thank you. And Param, do you have anything it looks like you want to add?
Yeah, I think I'm going to pick up from where Shagun just left on how certain programs or platforms can sort of influence social norms and conceptions around how women are perceived. I'll take example of Jeevika again. Back in 2014. We had a very interesting study done by an Arizona University professor, which looked at whether women collectives can actually influence the agency of women, in the sense that do they affect their role in household decision making, and how do they perceive their own value at the household level. And there have been extremely impressive results from these institutional platforms that women do tend to be more vocal and have a much higher agency when they are, participating in these programs in the long run. We have significant examples of enhanced mobility of women, which is considered as one of the important metric of empowerment everywhere. If you look at the community professional narrative of Jeevika, we have thousands of women who are not actually moving just within the state of Bihar, in different villages and in different communities, taking the message of the program, but across countries, across states. Women from Bihar are actually traveling to Jharkhand, to Rajasthan, to Assam, to all the northeastern states, to Uttar Pradesh, to actually mobilize new groups and support the program expansion. So I believe there is tremendous scope in terms of how these institutional platforms actually influence community behaviors. I'll actually try to address one more question using this opportunity. There was a question specifically regarding governance on how these platforms can possibly affect governance. And I would actually say that one of the important ways by which you look at governance improvement is whether citizen engagement itself has improved with its public institutions and private institutions. And that's where Jeevika has played an extremely important role. You look at Panchayati Raj institution in the village, you look at the local school, you look at the local Anganwadis, and women members from Jeevika are actually now involved by design, by government mandate, to be part of monitoring these institutions, the way they function. So it is an extremely important and empowering message which goes down the line to women across the state, that yes, they are supposed to actually monitor the local school. They're supposed to actually monitor the local Anganwadi center, the local health center functioning. So I think improving and expanding citizen engagement into how the public institutions functions is an important way by which we can measure improvement in overall governance itself. Thank you.
Thank you, and thank you for so neatly threading it with the governance question, Param. With that, maybe we've got about 5 minutes left, so I would like to touch on some of the other areas, and over to Mr. Dutta for this one, perhaps, on financial inclusion. So what role do you see financial inclusion components of the graduation program playing? And do households continue to use saving services? Do they link up to microcredit? How do you think of the participants as future clients, you know, once they have moved through the program?
See, this is also one of our criteria that after 18 months or 24 months of hand-holding support to them, they would be able to access mainstream finance, because whatever the assets we are providing, that of course, due to increase in their business opportunities and all these things, they need more credit. So within this 24 months of support services, we help them to access credit either from the microfinance institutions or from the bank, mainstream financial institutions and all these things. And as I have mentioned earlier, in the sense that the participants, the women, they are not part of the self-help group which we are directly implementing. So this is also one of the criteria, that they would be a member of the self-help group in her particular village, so that they would be able to access the credit from the self-help group also to expand their businesses. And I'd like to mention that we don't treat, or we don't think that they will be the future customer of Bandhan Bank. No, we help them whatever they are getting better. I would say that credit support services, as far as interest rate and other things are concerned, it is up to them. So as part of our financial literacy or financial education, we also tell them that these are the various banks which are available nearer to your village, nearer to area, and you can go and take loan from any of the financial institutions. And of course, the savings habit. So immediately after opening the bank account, which I would say that it happened after 15 or 16 months of support, so they start depositing into the bank. So it continues and the amount also increases day by day, because their income and all these things, that also increases. So financial inclusion and credit facilities and savings, that's also part of one of our parameters to judge that how we say that they are being graduated and graduated to mainstream financial institution also. Yeah.
Thank you. And I mean, we do have to wrap up now, but maybe Param, just 1 minute on, you know, reiterating for us the trajectory of what you see the SJY participants as going along on it, you know, once it has graduated, how it fits within the broader Jeevika structure.
See, I have shared. Yeah, Param, sorry.
No,
go ahead.
So I think in terms of the trajectory that the ultra poor households, I'd like to go back to the change of the program. The way Jeevika members actually move from one to another is that they build their capacity, they're able to access resources from the program, and then they're able to actually look at harnessing the public and I think this is the case of the ultra poor households. We're already seeing clusters even in case of ultra poor households, because many times poverty is also a function of being part of a certain social group, of being part of a certain community, at least in some locations. This is what we're seeing in case of household areas. They found a cluster. Take the example of a bamboo cluster. There are about 70 they're all actually traditionally more bamboo-based, and all they're extremely poor.
I'm sorry, your connectivity is cutting out. So maybe try turning off the video.
Sure. Am I audible better now?
Yes.
Okay, great. So I think, as I said, the focus again in case of ultra poor households will also be looking at them not as single households, but making sure that they're actually able to integrate and interact with the local economy. That's simply looking at developing clusters across specific activities, even for these ultra poor households. We're already seeing clusters forming around specific activities like bamboo-based products or honey or bee-based activities. And it's sort of
I'm so sorry.
as well.
It's still very choppy and we're kind of running against time. So maybe what I'd suggest here is, and to all the questions that we haven't managed to answer already, we're going to take this offline after the call and, look to get back to you perhaps in writing on the questions. And I know there's been a lot of interest, especially around the COVID question and about the, the long-term future and thinking about adaptations and that might be needed. So right now we are coming up against time, so I would like to take the chance to thank you all for joining us and also to thank our three amazing speakers for sharing your experiences with us. I know upcoming next on June 11th, PI is running another learning series session like this one, and I do think it's going to be focused on COVID. So stay tuned for more on that. And also, as mentioned a few times, they have their flagship State of the Economic Inclusion Sector report coming out this summer, which will cover over, I think it's 400 programs, and it will show the baseline of economic inclusion programs around the world to galvanize and continue this discussion. So thank you so much all for joining us, and of course, do keep joining in on socialprotection.org to learn more. I always find them fascinating and exciting. So thanks again. Do remember to fill in the survey and take care, and good day and good evening.